Then who actually first measured this heart electrical activity? So that's heart is electrical device, and that electrical activity can be measured. So humans invented electro, and cardio means heart, and gram means graphs. So heart activities, electrical property can be made visible. So that's Wilhelm Einthoven first created this in 1903. He's Dutch and he's a doctor, and he was the one who first create this device to measure the electrical changes during the beating of the heart. And so he's the father of cardiovascular medicine and by electrical measurement techniques. So for this discovery of mechanism of electrocardiogram, he got awarded Nobel Prize in 1924. And look at this, how big the machine is. And what's interesting here is he merged his two arms to this bed and then one leg. Compare this size with a modern ECG machine, which when we go to the hospital for regular checkup, the nurse put these attachable electrodes on our chest. And we also have electrodes onto our limbs, two arms and legs. And that small tiny machine will show up this ECG activity. So what's the difference between old and modern one? I would say in principle, it doesn't change much. And these electrocardiogram, the shape is not that different. And people named it as a P, QRS, T, something like this pattern, people named it. So the difference between these are, you see the size, and in the past, people put a salt water bath, so to immerse, because this is electrically conductible water, and while nowadays we can just attach electrodes in a simple way. So I brought my own ECG diagram, which I begged for the nurse. Please give me this so that I can share with my students. So look at this. This is recorded in 2013. I've got this strip of my ECG diagram, which is on written on top of this grid lines, just 1 millimeter. And this grid lines has a meaning. So for example, in vertical amplitude aspects, 10 millimeter of grid line means 1 millivolt, okay? And the x-axis is while the heart is beating, it kind of records. So the speed of recording is 25 millimeter, corresponds to 1 second, so that you know exactly the speed and temporal domain and this amplitude, the strength of the electrical activity. And one thing you notice is here, I, double I, triple I, and V1, 2, 3, 4, 5, 6. And there's AVR, AVL, and AVF. So total about 12 lead ECG can be displayed here. And this is in fact, our heart activity is one rhythmic activity is, as I said, it's a three-dimensional dynamic activity. So the net vector of electric vector can be actually changing in 3D. So for us and physicians to be able to see this easily, we decompose this into these 12 aspects. So like when I was taking this, this is me, and you see 1, 2, 3, 4, 5, 6 lead is on my chest while I wasn't naked. Here, 2 leads onto my arm and 2 leads onto my foot. So this is the shape of the geometry. So this V1 to V6 is showing the electrical vector onto this plane, cut across a plane, while there's this plane, my in plane is I, double I, triple I, and also AVL stands for augmented vector left, augmented vector right, and augmented vector foot. So this electrocardiography, ECG, or in German term, EKG, is a transthoracic, meaning that across thorax or chest, interpretation of electrical activity of the heart over a period of time, as detected by electrodes attached to the outer surface of the skin and recorded by a device external to the body. So how do we want to visualize this three-dimensional electrical vector by having this 12 electrode lead? So very simple way, we have this two arm. By the way, all these are, you have to see these blue patients, people are looking at you. So this is the left part. So you can consider as this two arm and foot as a inverse triangle. So from vector point of view, you can make an easy way. So let's say subtract from left arm to right arm. So we can create this vector. Well, let's name it as I. And then the other is subtract the foot from the foot and subtract the right arm. Then we can create this vector. And likewise, foot subtracted foot by left arm, create this vector. So this creates three ways of vector in plane. So this is I, you can see I, this vector, double I, this vector, triple I, this vector. And another way is like we can consider the body as like three, this 160 degree as apart as a 120 degrees. So this AVL, AVR, AVF, once you can create this, this is also a good way to visualize. So we can start from our center. So like these average of two limbs and foot, you subtract from the foot to average of two limbs. We can create the vector downwards to the foot side. So it's called augmented vector to the foot. Likewise, from this average, you can subtract from the left arm, then from the center to the left arm, this vector. And likewise, from the right arm, from the center to the right arm. So that's augmented vector right. So this augmented vector, foot towards foot, augmented vector toward left arm, towards right arm, as you see, minus 30 degree, 60 degree, 90 degree, 120 degree. So this way, in-plane activity of the heart electrical vector can be easily displayed. And also this position from the heart location makes it roughly about 30 degrees. So you can see these are like the entity is there, and these are the projection for easy interpretation of physicians. So what does this electrocardiogram mean, and how does this can be useful for figuring out those who have issues and problems in their heartbeat? So as you remember the previous time, the rhythmical activity of the heart starts from the atrium, which is a smaller room with a floppy muscles, and this contraction of the atrium causes an electrical activity here, a little bit small, which is called P wave. And then this electrical conduction through this nerve makes the whole ventricle to contract, which is the strongest and the most powerful real pumping action. So that is at highest amplitude, and we call this as a QRS complex. And then it has to recover. That recovery phase also creates an electrical activity called this T wave. So by this P, QRS, T, and sometimes U wave gives us physicians an idea about the status, the functioning of your heart. So this P as a wave and QR as a complex and T as a wave, we also are interested in the interval, the timing dynamics. So PR, this distance as a PR segment, and that between S and T, this period as an ST segment. And PR interval and QT interval gives us some idea for the physicians how to interpret your heart ECG. So the normal heartbeat looks like this. And we know normal heartbeat is usually from 60 to 100 beats per minute. If it's faster than 100 beats per minute, we call it as a fast heartbeat. And if it's slower than 60 beats per minute, that is slow heartbeat. Of course, if it's irregular, that is become a problem, and that we call irregular heartbeat. But physicians usually use jargon, which is more complicated than general laymen can hear. So you guys can understand and be able to use it. So that's some of the terminologies. Fast heartbeat, we call it as a tachycardia. Tachy in Greek means fast. And slow heartbeat, we call bradycardia. Brady means slow. And irregular heartbeat is a serious condition that we call it as arrhythmia. So arrhythmia is a condition the heart beats with an irregular or abnormal rhythm. So arrhythmia is a problematic if it becomes serious. You know, the heart to be able to function as a pump to send out oxygenated blood throughout the body and then collect those deoxygenated blood to the body, to the heart, it has to be coordinated. So if it doesn't do that job where it can become serious. So there are patients who have a problem in this arrhythmia condition have a tendency to enter into a real uncoordinated contraction, which means, you know, the ventricle has to pump in this way, but if it doesn't do this job in a coordinated way, then your heart cannot pump. And that's a medical emergency and which can be fatal. So those patients' heart need to be keep monitored, their ECG. And if this phenomena is happening, then we have to give electrical shock to recover, like reset the heart so that it can recover its normal rhythm. So this can save a lot of people who have this condition. And this phenomena is called ventricular fibrillation. It means in this ventricular fibrillation happens, and fibrillation means this uncoordinated contraction. So this is a very serious condition. And for that, biomedical engineers devised this implantable device, which will defibrillate this. So meaning, you know, recover from this fibrillation condition and by the resetting the heart, which we call cardioverter. So this device is named as an implantable cardioverter defibrillator. And what's the difference between the pacemaker and this ICD? It looks quite similar up front, but the pacemaker, the goal of this pacemaker is to make the heartbeat regular. So it just sends out a regular signal for the heart to contract, while the defibrillator has to listen to the heart ECG in real time so that it has to read the heart's signal ECG, and it has to have an algorithm when it becomes a problematic state. It has to send out a strong electrical shock impulse to reset or defibrillate the heart. So this implantable cardioverter defibrillator actually has to detect and recover abnormal cardiac rhythm. So to implant this device, patient needs a surgery, and I found this a helpful YouTube video for ICD surgery, and I hope you can watch this and see what medical process look like, what kind of biomedical devices and instruments has to be necessary for this procedure. So next time we will be discussing about biomedical imaging with example. Thank you for your listening.